I process prior authorizations for GLP-1 medications at a large medical practice. Want to know the approval rate for weight loss? About 15%. For every 100 patients we submit, roughly 85 get denied, even when they meet every clinical guideline, even when their doctor strongly recommends it. The system isn't designed to give you access. It's designed to delay and deny. But here's what most patients don't know. There's a legal, medically supervised alternative that bypasses insurance altogether. Let me explain how it works from the inside, based on direct experience within the medical system. My name is Robert Hayes, and I worked at Weight Management. But I work alongside physicians who prescribe GLP-1 medications daily, both for type 2 diabetes and chronic weight management. What I'm about to share comes from years of watching the gap between what patients need and what they can actually access. I see the paperwork, I hear the phone calls with insurance companies. I watch patients' faces when we tell them their coverage was denied. And I've also seen the other side, and patients who found alternative pathways to access these medications safely lost significant weight, improved their metabolic health, and did it without spending thousands of dollars or waiting months for insurance approval. Let me walk you through what really happens in our healthcare system with these medications. And then I'll tell you about the option and get more and more of our patients, and honestly, some of our staff are quietly using. Here's the typical process when a patient asks about GLP-1 medications for weight loss. Step 1, the physician does an evaluation. They check BMI, review medical history, assess for contraindications like thyroid issues or pancreatitis. If the patient is a candidate, the doctor writes a prescription. Step 2, we submit a prior authorization to insurance. This requires extensive documentation, proof of BMI over 30 or over 27 with comorbidities, records showing previous weight loss attempts, sometimes even dietitian notes or exercise logs. Step 3, we wait, usually 2 to 4 weeks for an initial response. Step 4, the denial comes. Common reasons, not medically necessary. Medication not covered for weight management indication. Step 5, we appeal. We submit more documentation. We write letters of medical necessity. The physician gives on peer-to-peer calls with the insurance medical director. Step 6, second denial. Sometimes a third appeal is possible. Usually it's not. The entire process takes 8 to 12 weeks on average. And the approval rate for weight loss, not diabetes, is abysmal. Even when patients do get approved, the copay can be $300 to $500 per month. And coverage can be pulled at any time if the insurer changes their formulary. Here's what frustrates me most. The physicians I work with genuinely believe these medications can help. The clinical evidence is clear. The FDA has approved them for chronic weight management. But the insurance system creates a barrier that most patients simply cannot overcome. So patients give up. They try another restrictive diet. They blame themselves for failing, when the truth is the system failed them. Let me explain why our physicians recommend these medications. In the first place, because understanding the science matters. GLP-1 medications, semaglutide is the most well-known, but there's also tirzepatide, and others work by mimicking a natural hormone your body produces called glucagon-like peptide 1. This hormone does 3 things. It tells your brain you're full. It slows gastric emptying so food stays in your stomach longer. And it improves insulin sensitivity, which helps regulate blood sugar. Your body naturally produces GLP-1 after you eat, but it breaks down in about 2 minutes. These medications extend that effect to about a week, which means sustained appetite control and blood sugar regulation. The clinical trials are impressive. The Step 1 trial published in the New England Journal of Medicine showed patients lost an average of 15% of their body weight over 68 weeks. And that's 30 pounds for someone who weighs 200 pounds. But beyond weight loss, we see improvements in hemoglobin A1C, blood pressure, cholesterol, and inflammation markers. The SELECT trial even showed cardiovascular risk reduction in patients with pre-existing heart disease. These aren't cosmetic medications, they're metabolic interventions. And that's why it's so frustrating when patients who would genuinely benefit can't access them because of insurance barriers or cost. Here's the conversation that happens in our clinic more often than you'd think. I started hearing these comments about 6 months ago. At first, I was skeptical. Compounded medications, telemedicine platforms, it sounded too good to be true, or worse, unsafe. So I did what I do with everything in healthcare. I researched it. Compounding pharmacies have existed for decades. They create customized medications for patients who need specific doses, have allergies to inactive ingredients, or need access to medications that are temporarily in shortage. Right now, the FDA lists brand name semaglutide as being in shortage due to high demand. Under federal law, when there's a drug shortage, compounding pharmacies are legally allowed to create formulations of that medication. But here's the critical distinction. Not all compounding pharmacies are created equal. The legitimate ones are FDA registered, source ingredients for FDA-approved facilities, follow USP standards for sterile compounding, and are licensed to ship across state lines. The sketchy ones cut corners. They might use semaglutide sodium, a fault form that hasn't been evaluated by the FDA, instead of pure semaglutide. They might operate without proper licensing. About 3 months ago, one of our medical assistants mentioned she was using a platform called Direct Meds. She'd lost 28 pounds and said the process was more thorough than she expected. I looked into it, not to promote it, because patients were starting to ask me about it. Here's what Direct Meds does. They connect patients with board-certified physicians who specialize in obesity medicine and metabolic health. You start with a comprehensive medical intake, not a 3-question quiz, but a real assessment of your medical history, current medications, previous weight loss attempts, and screening for contraindications. If you're a candidate, you have a telemedicine consultation with a physician. Not a physician assistant doing a rubber stamp 5-minute call, an actual doctor who redeems your case and determines if GLP-1 therapy is appropriate for you. If approved, they prescribe compounded semaglutide from FDA-registered, US-based compounding pharmacies that are licensed to ship sterile compounds. The cost starts at $147 for your first month as an introductory offer, then a fixed monthly price thereafter. Now, as someone who works in healthcare, I need to be clear about something. GLP-1 medications are not appropriate for everyone. Absolute contraindications include personal or family history of medullary thyroid carcinoma, multiple endocrine neoplasia syndrome type 2, history of severe pancreatitis, pregnancy or planning to become pregnant, history of severe gastroparesis, relative contraindications or situations requiring extra caution, active gallbladder disease, history of diabetic retinopathy, taking other medications that lower blood sugar, severe kidney disease. This is why medical screening matters. Whether you're getting semaglutide through your endocrinologist, through Direct Meds, or any other pathway, a qualified physician needs to review your history first. And once you start, ongoing monitoring is critical. You need to report side effects. You need dose adjustments as you progress. You should monitor your progress and report any side effects to ensure safe use. Here's something I tell every patient who starts GLP-1 therapy, regardless of how they access it. The medication is half the equation. Your nutrition and lifestyle are the other half. We see 2 types of patients in our clinic. Type 1 takes the medication, doesn't change anything else. Loses some weight initially, then plateaus quickly and experiences more side effects. Type 2 takes the medication, prioritizes protein intake, does resistance training twice a week, focuses on whole foods, and loses weight steadily while feeling better overall. The difference is dramatic. Here's what you absolutely must focus on. Protein. Aim for 100 to 150 grams daily, depending on your goal weight. Without adequate protein, you'll lose muscle along with fat. Muscle loss tamps your metabolism and makes weight regain almost inevitable. Strength training, at least 2 sessions per week. This signals your body to preserve muscle tissue while losing fat. You don't need a gym body weight exercise work. Fiber, 25-30 grams daily. These medications slow digestion, so fiber prevents constipation and supports gut health. Hydration, half your body weight in ounces of water daily. GLP-1 has caused increased sodium excretion, which means you lose more water. Dehydration amplifies side effects like nausea and fatigue. The patients who succeed long-term treat the medication as a tool that supports lifestyle change, not a replacement for it. I need to be honest about something that promotional content rarely mentions. If you stop taking GLP-1 medications, without maintaining lifestyle changes, most people regain the weight. This isn't a medication failure. It's how obesity works as a chronic disease. Just like blood pressure medication doesn't cure hypertension but manages it, GLP-1 medications manage obesity. They don't cure it. But here's what I've observed in our patients who succeed. They use the time on medication to build sustainable habits. They learn portion control because their appetite is reduced. They establish consistent exercise routines because they have more energy. They figured out which foods make them feel good versus sluggish. When they eventually reduce the dose or transition off, they maintain most of their results because they fundamentally change their relationship with food and movement. And medication creates the window. You build the foundation during that window. So here's what I tell patients who ask me about this privately. First, educate yourself. Research GLP-1 medications. Understand the benefits, the side effects, and the contraindications. The FDA's website has patient information. The published clinical trials are accessible online. Don't just rely on TikTok testimonials, and have a conversation with your doctor. Even if you're considering a telemedicine option like direct meds, talk to your primary care physician first. May know your full medical history and can help you determine if this therapy makes sense for you. Third, if you decide to pursue it and traditional pathways aren't accessible, go to the link in the description. Direct Meds has a medical intake questionnaire that takes about 5 to 10 minutes. It's comprehensive. They ask about medical history, current medications, previous weight loss attempts, and screening for contraindications. A board-certified physician reviews your information. If you're a candidate, you'll have a telemedicine consultation where you can ask questions about dosing, side effects, what to expect, and how to structure your nutrition. Here's what sets Direct Meds apart from some of the other options. I've seen patients try. Real physician oversight, not automated approvals or nurse practitioners you never actually speak to. US-based, FDA-registered compounding pharmacies with proper sterile licensing, you can verify their credentials. Transparent pricing with no hidden twos. Or membership traps, what they quote is what you pay. Fast delivery once approved, usually 2 to 3 days. And they accept HSA and FSA, which helps with the cost if you have those accounts. But here's what they cannot provide for you: the discipline to prioritize protein, the commitment to strength train, the willingness to choose whole foods over ultra-processed options most of the time, the consistency to show up for yourself, even on days you don't feel motivated. The medication is a powerful tool, but you're still the one wielding it. If you've been struggling with weight despite genuine effort, if you've been denied by insurance, or simply cannot afford $1,400 per month, this is a legitimate, medically supervised option worth exploring. The link is in the description. Take the medical intake, see if you qualify. And if you do, give yourself the opportunity to finally see progress with proper medical support. One last thing, I don't get paid to talk about this. I'm sharing it because I've watched too many patients cry in our office when they get denied coverage for a medication that could genuinely help them. And I've also watched staff members and patients quietly succeed using this alternative pathway. You deserve access to medical care that works. The insurance system shouldn't be the barrier between you and effective treatment. Go take that first step. The link is below. Thank you for watching, and I hope this information helps you make an informed decision about your health.